Hi everyone. Today I'm going to talk to you about the paranoid personality disorder. According to the DSM, which is the manual that most psychologists use to diagnose clients, the paranoid personality disorder, or PPD, it is a type of a disorder that's part of the A cluster. So I'm not sure if you've seen my previous video, but we have three types of clusters. We have cluster A, cluster B, and cluster C. A is the type of personalities that are considered mad. B is bad. And C is sad. So type A includes three types: the paranoid, the schizotypal, and schizoid. Not schizotypal, I'm sorry. Schizotypal. I can never pronounce that one. It's very scary. Everybody pronounces it differently. But anyways, these are the three major types: paranoid, schizoid, and schizotypal. And the word schizo may scare people, but don't let that fool you. So today I'm going to focus on the paranoid. So paranoid personality disorder, it starts usually in the adulthood. You cannot really see it in children because it's they're still developing. No one seems to know the exact root of the cause of why people have it, but it could be genetic or it could be the environment you're on or whatever's affecting you. So what happens? What does it feel like to be a parent living with it? We're all prone to being paranoid. It's normal to be a little bit suspicious, but when you live in this pattern and the trait is with your behavior and your beliefs and your thoughts all the time, is always consistent, most likely you have it. You have paranoid personality disorder because it's not normal to live with that kind of fear all your time or your life. So what happens to the client is that they're usually very, very distrustful. They do not trust anyone. They live with suspicion that everybody around them is going to attack them, or everybody around them is not loyal, or that everybody around them is going to hurt them at one point. The trust is completely gone throughout all the relationships. They have very hard time confining with other people or finding loyalty with someone. It takes a long time for them to trust someone. They're easily angered, easily triggered, and they really hold grudge, like a deep grudge that's like killing them from the inside. Most of the time, they are always suspicious of their friends or partners, that they're unfaithful. They're completely destroying their relationship with anything that they think that it may trigger something that their partner is unfaithful or doing something. They find it very hard to working with other people at jobs, and they are completely detached from the world, meaning they live in a kind of social isolation because they cannot trust anyone. They have a lot of trouble seeing their own problems. It's never their fault. They don't believe they have an issue. They believe that they're always correct. It's very hard for them to relax. And the main thing is the suspicion. They're always suspicious. So if you have it, your doctor will diagnose you, or a psychologist will diagnose you. And if they have discovered that you have PPD or paranoid personality disorder, don't lose hope. There is always treatment for you. All you have to do is just acknowledge that you need help. That's the most important. Then there's a lot of combination of therapies that you can do with your professional therapist to help you overcome your suspicion. If your situation is extremely severe, your doctor may prescribe antipsychotics or antidepressants to help you go through the transition. But remember, it is all in your mind. Don't be too hard on yourself, because it could be that you've had a very bad childhood. You could have had very bad situation where trust was just completely hard for you to trust anybody else. Remember, we all have this. We all have instinct. We all have paranoia at one point. But if you live with it all your life and it's affecting your behavior throughout your whole social system, you may have that disorder. So don't lose hope. There's always help. And all it takes is for you to take the first step in saying, you know what, I think I need it. I think I have a problem. I need help. And that's all you have to do. All right? Good luck to you.